Low blood pressure, also known as hypertension, is a condition where the force of blood against your artery walls is consistently too low. Blood pressure is measured in millimeters of mercury, or mmHg, and represented as two numbers, systolic and diastolic. Systolic pressure, the top number, measures the pressure when your heart beats. Diastolic pressure, the bottom number, measures the pressure between beats. A blood pressure reading consistently below 90/60 mmH is generally considered low. While often less discussed than its counterpart, hypertension or high blood pressure, hypertension can be equally concerning. Hypertension occurs when the force of blood against your artery walls is consistently too high, putting extra strain on your heart and blood vessels. This can lead to serious health problems like heart disease and stroke. Hypertension, on the other hand, can result in inadequate blood flow to vital organs, leading to dizziness, fatigue, and even fainting. Unlike hypertension, which often develops gradually over years, hypertension can sometimes occur abruptly, requiring immediate attention. Hypertension isn't always accompanied by noticeable symptoms. When symptoms do surface, they often manifest as dizziness, lightheadedness, and a feeling of faintness, especially when standing up quickly. Other common symptoms include blurred vision, fatigue, weakness, nausea, and difficulty concentrating. Several factors can contribute to low blood pressure. Dehydration, a common culprit, occurs when your body loses more fluid than it takes in. This can lead to a decrease in blood volume, thereby lowering blood pressure. Other risk factors include anemia, severe infections, certain medications, low blood sugar, heart conditions, and nervous system disorders like Parkinson's disease. Nutritional deficiencies, particularly of vitamin B12 and folate, can also contribute to hypertension. These vitamins are essential for the production of red blood cells, which carry oxygen throughout the body. Pregnancy, due to hormonal changes and increased demand on the circulatory system, can also lead to lower blood pressure, especially in the first and second trimesters. Additionally, older adults are more prone to hypertension due to age-related changes in the circulatory system. While dietary recommendations often focus on lowering sodium intake to manage hypertension, individuals with hypertension may benefit from a controlled increase in dietary sodium. It is crucial, however, to consult your healthcare provider before making any significant dietary changes. Focus on incorporating nutrient-rich sodium-containing foods into your diet. Canned beans, for instance, are a good source of sodium, providing around 440 milligrams per half cup. Canned tuna, rich in omega-3 fatty acids, vitamin B12, and folate, also contains a significant amount of sodium, 648 milligrams per 5-ounce can. Cottage cheese, fortified breakfast cereals, olives, and salted roasted nuts are other healthy options to consider. Distributing your sodium intake throughout the day is crucial. Instead of consuming all your sodium at once, aim to include small amounts with each meal. This helps prevent sudden spikes in blood pressure while ensuring a consistent intake throughout the day. Remember, moderation is key, and it's essential to work with your healthcare provider to determine the appropriate sodium intake for your individual needs. In addition to dietary modifications, several lifestyle changes can help manage hypertension. Staying adequately hydrated is crucial. Drink plenty of water, fruit juice, or herbal tea throughout the day, especially during hot weather or after exercise. Regular physical activity can strengthen your cardiovascular system and improve blood circulation. Start slowly and gradually increase the intensity and duration of your workouts. Eating small, frequent meals can help prevent postprandial hypertension, a drop in blood pressure that can occur after eating. When transitioning from a lying or sitting position to standing, do so slowly to avoid sudden drops in blood pressure. Compression stockings can also help prevent blood from pooling in your legs, improving blood flow back to the heart. Interestingly, some studies suggest a link between chronic low blood pressure and an increased risk of dementia. While more research is needed to establish a definitive connection, ensuring adequate blood flow to the brain is crucial for cognitive health. If you experience frequent or severe symptoms of hypertension, it is essential to consult your doctor. They can help determine the underlying cause of your low blood pressure and recommend appropriate treatment options. Remember, managing hypertension is an ongoing process that requires a multifaceted approach involving dietary modifications, lifestyle changes, and regular medical checkups.